know exactly where we stopped. So, I believe, good evening, ladies and gentlemen. It's me, Nachmera Irene, once again. I'm here to finish up our previous lectures. I was told because of internet, so we couldn't be able to finish up this entire process. But I don't know exactly where we stopped, but we are going to catch up from here, continuing from the risk factors for mother transmission to child via HIV and syphilis. Well, the subtopic or the continuing subtopic is looking at the risk factors. So, what could be the risk factors that a mother could be possibly transfer HIV or syphilis to her child? Risk factor number one is the lower maternal CD4 account, where we are basically looking at if a mother, her low maternal CD4 account is low, as well as if her viral load is also high, it makes or it advances more to develop or to look at the disease stages at which are also at a higher risk, or they increase at a risk of transmitting the HIV via their infants, and which is also as a result of a higher blood viral load, where we know that it increases or it usually sheds during their genital tract, and also decreases the maternal immune responses, which contains the virus, which can easily be uh, contracted to their infants. So number three is the untreated or inadequately treated maternal infections. If a mother continuously does not, or she gets an infection and she doesn't treat the infection, in case it prolongs, it can also be another challenge. And more to that, in case she also gets this infection, there are high chances of her to transmit the infection to the unborn baby, or if she gets the infection in the process of giving birth, she may also virus 2 or the infection 2 to the infant. So more to that, we also have another risk factor, which is prolonged rupture of membranes. This is best a mother goes to the delivery, and this is when we are looking at that the duration is more than 18 hours prior the delivery. So if the delivery is so long, then in most cases it causes some complications when a mother is giving birth, which could also be at risk for positive mothers to delay long when they are giving birth. So more to that is the preterm delivery, which is also we are looking at a birth that is concerned, or that occurs before the normal delivery, because usually we know normal delivery occurs at least 40 weeks, but this preterm delivery or birth, it usually occurs within 37 weeks, which also increases high risk of infections, and also increases high other risks like cesarean, a mother to go for cesarean, and so many other complications. Then another risk factor is the invasive procedure, which is the kind of procedure whereby we know the purpose for all the deliberate of it. It we use to access it through the body, where it is gained via that kind of an incision. So this is usually in case there is a puncture, so we need to use some instruments. And when instruments are used to maybe amend that puncture, usually like using of needles and other instruments, usually if there is no seriously repercussion taken place, then through such kind of a procedure, it can also make a mother to contract or to transmit the virus through the baby, probably maybe in so many other conditions. So more to that is the mixed feeding method, which is basically recommended that if after a mother has given birth, several many mothers today they use this kind of a method because others believe like it is so simple. It can allow them to go and work. It can also help them to have health babies and so many other things. But simply because when we give birth to children, these are fragile kids or these are fragile individuals whereby their immune system is still low. So this kind of supplements that we give to them, it usually makes them to get also contracted to other infections, fever, and etc. So this kind of method is can also increases high risks to a mother via transmitting the virus. So more to that, we shall also look another subtopic, which is looking at the PMTCT and the EMTCT programs. So basically, these are programs where we are focusing so much on prevention and we are focusing so much on eliminating the virus, such that a mother cannot be in position to transmit the virus to the baby. But in the first program, what occurs? This is a program which is aimed to reduce index and mortality of HIV as well as syphilis among pregnant women or mothers to their children or their infants. And also, this program is also intended to improve the quality of life of mothers who are positive and at the same time they are pregnant and at the same time they have also already given birth to their infants. So still on that, the benefit of this program is that it helps so much to look at the preventive mechanism, on how can we prevent the new infectious diseases, how can we reduce very many kind of infection diseases, illnesses, as well as also helping mothers not to die while giving birth, and at the same time also to help their babies not to die as well. More to that, the program also benefits in a way that it also enhances maternal and child health, as well as promoting the human rights because people who are positive, most cases, their rights are neglected. So such programs advocates for their rights as well as their equality in terms of accessing services and so many other things that they want to access in healthcare centers. It also contributes to a global end or a global goal of ending AIDS as well as contagious syphilis by the year 2023. So more to that, what could be the challenges that are encompassed within these two programs? Well, number one is the low coverage and retention of services. We know where we are living in. So many people are not well versed with these programs. So the coverage is yet still low. Okay. And since it is still low, so many people are not well versed with this kind of services. Secondly, it is also, we shall also look at stigma and discrimination, where people who are positive or mothers who are positive, in most cases, they feel like they are stigmatized and they also are discriminated either by their spouses, either by their friends, or either by their family relatives, or even friends as well, like I mentioned. So these programs, we must also to make sure that people should not get discriminated because of their conditions. Because after all, it is not the end of the day for a person to be positive as well as she is expecting or giving birth to a baby. Furthermore, we shall also look at lack of male involvement. So this is basically where we are expecting men to come and be actively involved in these programs because at the end of the day, during antenatal visit, we need men to participate. We need men to get involved. We need them to take part to know how these programs are very beneficial, how are they very important to them in such a way it can also help both a mother and then the father in the way on how they can protect, and we have already seen all those benefits. More to that, another challenge we have via these programs is our weak, healthy care system or health systems. Our systems are still weak. When we are talk or when we talk about to implement these programs, they don't do exactly what we expect them to do. So in such a way that if all in all we have programs that are, or we have a system which is so strong, which is going to introduce policies which are going to make sure that all these programs are introduced in our healthcare centers, then we shall really try to eliminate as well as prevent mother to child transmission of HIV. More to that is the limited resources. The fact that we are still in a low developed countries, we are also challenged with the resources. Resources are not enough because these programs, sometimes they also need some resources, probably like maybe during health education, you need to educate to mothers, so you need to provide some materials which may also help you to facilitate on how the entire program is going to be smoothly communicated to the well targeted beneficiaries or your audiences. So, lastly, is the competing priorities. Here is also another challenge because when you go to healthcare centers, the priority of varies or they differ, you know. So, people probably maybe they may look at other priority that is so more important than protecting mothers who are positive, as well as we are also looking at how they could try to prevent HIV among their children. So furthermore, what strategies can we use via these two programs? So what could be the key components to use via these programs? Number one is that we need to early identify and test of pregnant women for HIV as well as syphilis. Okay, because we know syphilis is a seriously another complication cases, you know, more especially even if a woman is not positive with the virus. But we know the complication of syphilis, it can also make some person to be infertile if it is not treated very well. So we need to early diagnose or test, and if we test, then we know the state or the situation that the mother or pregnant women are in. That is strategy number one. Number two, we need also to provide ART or any other preventive drug, prophylaxis, which can help a mother not to transmit the disease to her unborn baby. Number three, we need to look at the safe procedures or mechanism or practices during when a mother is giving birth. What practices are we going to use during delivery? Because the reason as to why we earlier on recommend them to go for testing is because we want to know their HIV status. That during the time of delivery, it will help us to know how to save the baby from getting the virus during the time of delivering. It also helps us that the safe practices that if a mother is positive, what could be the best way that a mother could do while feeding her baby, and as well as during counseling process, you know, it is like the kind of support that mothers need because some people they fear I'm positive, I'm also scared I might transmit the disease to my baby. So all in all, they need seriously support and counseling in order to help them to be strong and as well as not to transmit the virus to their babies. Furthermore, early diagnosis and treatment of infants who are exposed to HIV and syphilis is also recommended. That in case, because you never know, because we know that you can be in an era which you're not intending to take place or to happen, but in case it has happened, then we need to do early diagnosis and as well as treating of for those infants who are exposed to HIV or syphilis. Second, lastly, is that we need to do follow-ups and linkage of care for mothers who are positive as well as their children as well. Because in most cases, in the hospital, when they come to hospital, yes, they may be trying to be serious. But when they go back to their families or home, they'll be like, nobody's seeing me. So after all, I have a time. They try to live or lose hope or interest in whatever kind of strategies that we have laid down, the art therapy, and so many other things, which they may try to neglect or ignore. So we need to link up with them. We need to give them a rapport care such that we really know how they are progressing or how they are doing with their children. Furthermore, we need to do family planning, counseling, and as well as services, because we know family planning, we know what it's all about. We need to advise them to space when they're giving birth, such that they can give that tender care love to their children. Furthermore, we shall also look at other components like psychosocial support. Psychosocial support is also needed to mothers who are HIV positive, because they need it psychologically. Because any individual or any other person, we may have our own demons. So the support psychologically is needed such a way that we feel like we are not alone, or they are not alone in this kind of a situation that they are in. We need to engage the community to be actively also involved via these two programs, because at the end of the day, they are the ones who are going to discriminate these positive mothers, and they are the ones who are also going to discriminate these children who are positive. So at the end of the day, we need them to engage them, and they actively participate. They get to know all these programs, that in case probably maybe there could be somebody else somewhere, then they need to be aware of what they're supposed to do and things like that. Furthermore, we need also to look at quality improvement. That for us, these two programs to be successfully, implemented in our communities, in our healthcare centers, it must all about be of quality. That is when we know that mothers, the services that they are receiving is of excellence. And if it is of excellent, then we shall know that we are trying to help them to not transmit the virus to their children. Then we also need to monitor and evaluate, as well as advocating for their rights as well. Because since they are mothers, yes, I know somehow, somewhere, they also might lose it. So we need to advocate for them, or as well as we advocate for them to have this kind of programs. So furthermore, we shall also look at another subtopic, which is drugs. What could be the drugs used in this prevention of mother to child transmission of HIV? Well, we have talked of antiviral therapy, which is which is more importantly for a mother and then the infant as well to use, such that these drugs like Proflax, it could be the opportunistic infection and co-infection, which needs to help a mother not to transmit a virus to their child. Then furthermore, the therapy of art is also useful, or it is a use of a combination of the drugs that suppresses the replication of HIV and also improves the immune system of of a person living with HIV. So art can also help to reduce the viral load in the blood and as well as other body fluids, which lowers a risk of mother transmitting HIV to other individuals or to others, including their babies as well. So more to that, how can we initiate art? The initiation of art, it can be initiated at any stage of pregnancy, depending on the eligibility criteria and as well as the availability of services. So WHO recommends that the lifelong art for all pregnant women and as well as breastfeeding women living with HIV, they must take art such that they don't expose their babies to get HIV and AIDS. So regardless of CD4 accounts, we need also to look at other clinical stages, which is also much more recommended in case a mother is using this kind of a therapy. So more to that, ART is also initiated for the infant consistent of a short course of antiviral drugs from birth until the end of the breastfeeding period. So when a child now is no longer breastfeeding, then there is no need of that child to continuously, or a mother to use the antiviral drugs, or until the HIV infection is excluded within the infant, then that is when a child has to stop using the ART therapy. So the duration and the type of these drugs depend on the maternal ART remain, and also the infant feeding method. So if all that is successfully done, then there would be no need of a child to use the art therapy, or to be enrolled in the art therapy again. So fluflux for opportunistic infection and co-infections. So here we are looking at that fluflux for opportunistic infections and co-infections is usually the using of a drugs which we use to help us to prevent or treat infections, and that has occurred when HIV weakens our immune system. So this includes tuberculosis, malaria, etc. And we believe that this kind of a drug is so much more important. It can help us both to benefit the mother and the infant, as well as helping us not to transmit from a mother to child of HIV. So the most common prophylactic drugs used to use in this prevention of mother transmission of disease, we have the cotimilazole and so many other drugs. So you may help me with those drugs. So, but we use those kind of drugs. It helps us so much uh, to prevent mothers who, such that they don't transmit the virus to their kids. So more to that, what could be the different stakeholders in the prevention of mother transmission of the virus and eliminating of mother to child transmission of the virus? Well, we need the policymakers who are making the policy such that we get them to get involved, we make them to participate, we make them to know the entire process of these programs. Then secondly, we need the health managers, because they are the ones who are managing these healthy care facilities, or they are the ones who are providing or managing the health cadres who are providing these services to mothers. So we need them also on board. Next, we also need the health workers, or the health cadres, or the doctors, all those other relevant health working individuals. We need them because they are the ones who also technically provide the services to these mothers. We need civil society organizations to also come on board, because they may help in providing resources and as well as communicating health messages to the communities. We need also development partners to also take part, as well as the donors, because like in the case of a service which needs to be given to mothers, probably maybe they need to give him anything that new has come on board, drugs for instance, then they need to come on board, provide funds which can help to make sure that all the logistics which are needed to make these services to be successful, then they will provide them. Researchers, we need them because every day new information needs to be discovered. So we need them on board, such that at the end of the day, they need to tell us how credible these programs are. And in case of any new information, they need also to let us know about that new information, or in case there is a gap, they need also to tell us where the gap is in these two programs. Media is very important because it helps us in disseminating the information. In case there is a gap or in case there is a new discovery, then media will help us as to communicate or disseminate information such that even people who are deep in a remote area, and today since we are using the global trend of social media, it's very more effective in disseminating information more probably on these two programs of prevention and eliminating of mother to child transmission of HIV. So we need women as well, men, families, communities that are affected by HIV and syphilis to also take part in this participation. Okay, so more to that, what now could be the HIV care principle? Well, principles, they are guidelines. They are like acting as a values. Sometimes principles are looked at as standards that one has to use in delivering of the services. But in this case of HIV, we are looking at the guiding values and standards that inform the delivery of HIV care as well as services to people who are living with HIV and AIDS. So more to that, they are also based on the best available scientific evidence such that we look at the principles that even if a person is positive, that person has also got a human rights. So we need to look at the ethical principles where we as professional individuals, we need to act according to how our ethical codes tells us to do so in a such that we can apply it to help and provide services to people who are in need or who are living with HIV and AIDS. So more to that, principles or the care of principles also help us to ensure that HIV care and services are effective, efficient, equitable, accessible, as well as acceptable and sustainable. I know these two programs that we later on looked at, preventing and eliminating, so many people don't even know or understand what these programs are all about. So, and some, and also due to some cultural beliefs, we need the community members or different from those cultures to accept these programs or accept people who are living with HIV and AIDS. More to this, more to this of this aiming of this HIV care is that when you go to most Arab countries and then they kind of discover that you're having HIV and AIDS, in most cases they deport them and take them back to their countries. Or sometimes others are even killed because they look at AIDS as, something so awful, something so, I cannot even describe how they look at it. But in simple terms, they have failed to accept that a person can live even if he has HIV and AIDS. So several many foreigners who go to their countries, they are seriously discriminated and they have failed to accept that HIV can also be part of them. So they don't want to socialize with individuals who are victims of HIV and AIDS. Why is this principle important? It is important because it provides high quality, comprehensive, and integrated HIV care as well as services that addresses the physical, mental, social, and emotional needs of people living with HIV and AIDS across in all the continuum of care. So we need these principles such that even if a health person is working on a positive person, then they should make sure that at least services are well given to positive patients the way they are also being given to people who are negative. Number two, why it is important? Because it helps us to promote patient-centered and as well as participatory approach that empowers people with HIV and AIDS, such that they can make informed health and as well as well-being decisions, and we need to engage them in self-care and as well as self-management. I believe this aspect of self-management is very important to people who are positive, because they need to know this is not the end of the world. They are going to be living with the condition for the rest of their life. Some people, when they told to go to hospital, yeah, they feel like they are already sick in the hospital. So we need to promote and let the patients participate in a way that they need to make their own decisions, and as well as getting involved in taking care of themselves. Furthermore, we also need to, it is why it is important, because it's strengthening the coordination and collaboration among stakeholders involved in HIV and HIV care, as well as service delivery, such as the health workers, community workers, and any other stakeholders. So we need to strengthening our coordination and the way we collaborate with them. That is why we believe that these principles they are very important. Furthermore, we need to monitor, evaluate the outcomes and the impact of HIV care and services in a way that it will also help us to identify where the gaps are, where the challenges are, and where the needs need to be addressed. So that's why the principles are very important. If we discover that probably maybe some of health cadres, they are not acting the way they are supposed to do, the services they are giving to people with AIDS is not quite of standard, of quality, then we need to address those, and in a way that it will help us to boost our services to be of quality and to be of standard. More to that, we need also to foster the continuous learning and improvement of HIV care and services based on the available data, or based on the evidence that we have gathered and the feedback that we have got from people, as well as the renovation that we need to continuously keep on doing for these HIV care and services that is being given to people who are living with HIV and AIDS. For example, if we have evidence-based, so evidence-based, if it's available, then it should always help us to get informed, at least to have the scientific knowledge, the latest info, and the best practices that we can adopt based on the local context or the situation, as well as based on the available resources. Okay. Then secondly, if we look at the patient-centered, this is where we are focusing so much that we should respect the dignity, the autonomy, the rights, preference of people living with HIV. Okay, so if, for instance, a patient tells you, I'm not going to use I don't want art therapy, then you shouldn't enforce it to him or her. Let them make their own choices, because I believe that some patients believe that they believe in spiritual healing, where a person will be much more well confident that for me, if I pray, God will heal me. And we have had several many stories, by the way, where people giving testimony about, I was positive, but God cured me with this virus. So we need also to respect uh, the rights of our clients, and we need to also honor their preferences in when we are planning, when we are implementing, when we are evaluating, and as well as when we are improving of their, their care. So more to that is the comprehensive. Comprehensive, this is where we should address the holistic needs of people living with HIV across prevention, testing, diagnosing, treatment, maintenance, and as well as the support that we should give them. These people need a lot of support, either from the health care personnel or either from other individuals. So we need all those kind of support. So more to that, we need also to integrate the kind of the HIV, the kind of the linkage, and with other health as well as social services with people who are living with HIV, or the benefits such as the tuberculosis, sexual and other reproductive health issues, as well as mental and substance use, nutrition, etc. We need also to coordinate, like we mentioned earlier on, with other stakeholders in such a way that they need to help us in the delivery, where we look at that if the kind of services we should give to them, it has to be with a joint effort with other multidisciplinary team of healthy workers or the community health workers, or who will help us to communicate effectively and also work collaboratively to streamless care of people with living with HIV. Equitability or equitable, it is where we should focus on the access, affordability to people living with HIV, that regardless of their gender, regardless of their age, regardless of their sexual orientation, regardless of their gender identity, race, ethnicity, they have to make sure they get access to this care, and they must also afford this, this care. So more to that, we shall also look at the ethics and human rights in HIV care. So this in particular, we are saying that it should guide us on the ethical and human right principles that respect the dignity, autonomy, and diversity of monopoly, looking with all affected individuals. They are also human beings. The virus does not mean that they are not human beings. So they also have got the rights. So we also need to respect their rights as well. So other considerations concerning to human rights that we should respect is non-discrimination. We shouldn't discriminate them because of their sexual orientation, because they are homosexuals, because of their HIV status, because of their age, because of their race, because of their religion, disability, and so many other things. Also to get informed, we need also to get informed consent with people who are living with people living with or affected by the HIV, in a way that we shouldn't, or we should always get consent forms or get an informed consent from them. We should also make sure that we get comprehensive information about their health condition and treatment option, as well as the potential benefits and the risks. So they should be able to consent to or decline to any medication, intervention, or any services. If they have not yet given you their consent, then you shouldn't insist on what you think is right at your side. So confidentiality is also another ethical consideration we should keep for people who are living with the virus. We should keep their information private. We shouldn't disclose any information that they have given to us. So we should protect their personal data. We should also look at another ethical rights of participation. People living with the virus, they should make sure that they have also got the right to participate in decisions that affects their health and their well-being as well. So they have a right to participate during planning, during implementation, during evaluating of HIV services. Accountability is also another ethical consideration to put into consideration. So when we are providing them the services, we should be transparent. We should be transparent and accountable, and as well as responsive to the needs and expectations of people living with the HIV and AIDS. So we should be accountable for all that. So we should also respect their values, their beliefs, their practices, and as well as that, make sure that we serve and avoid imposing our assumption or judgment on them. Why did you get the HIV? How did you get it? Didn't you know that the virus is there? Why didn't you use a condom? So we should stop making those kind of judgments to them. We should also recognize and address issues of stigma, discrimination, barriers that people who are living with virus are facing or going through. We should also communicate effectively, respectively, with people from different culture, perspectives, and as well as backgrounds, using appropriate language, terminologies, and non-verbal cues. So we shouldn't use languages that is going to probably maybe ignoring or known or disrespecting somebody because of where they're coming from. Sometimes there could be some sign languages, which is in terms of insult to other individuals, because in their cultures, such kind of sign languages is an insult. So we should be very mindful in that kind of aspect as well. So we should also seek to learn from people you serve and acknowledge their strength, reliance, and coping strategies as well. Because learning does not stop. So we all can learn from them. We should also provide culturally appropriate and tailored information, education, prevention services that meets the needs and the preference of people you serve. Furthermore, more other cultural competencies in HIV, we should also collaborate with other professionals and community organizations who are experts and more experienced in working with the diverse affected people with HIV and AIDS. We should also engage in ongoing self-reflection and professional development to enhance cultural competence and as well as sensitivity skills, because the Are you there? Are you now seeing the slides? Mr. Waswa? Hello? Number one, I talked about integrated. That when we are following or when we are using these principles, it is always very important that we must put our ethical considerations to make sure that we link with other health providers and other social services that can help people who are living with HIV and AIDS, and they can also benefit from this kind of services such as tuberculosis, and other services like sexual and reproductive health, mental health, and substance use, and as well as nutrition. Then we need also to look at the another principle, which is coordination. Okay, with coordination, we need to coordinate with other multiple disciplinary teams of health workers, like the community workers, public health specialists, who will help us to actively communicate with people who are living with the HIV. Then another principle in the example is equitable. In equitable is that we must make the services available and affordable to people who are positive, in the way that we shouldn't look at their gender or discriminate them because of their gender, age, sexual orientation, and gender identity, and etc. We must make sure that the service is for all of them. Then furthermore, we must also put into consideration that we need to look at the ethic and the human rights, that they are also human beings. So these principles will help us to guide and also to bear in our minds that we need to respect the dignity of those positive people, the autonomy and the diversity, and also the the monopoly of living, or people who are living with HIV and AIDS. We must also respect their rights. So furthermore, we must also put into another principle of non-discrimination. So this is a principle where we are talking about that we shouldn't discriminate them, that because I'm positive and I am a homosexuality, then people are discriminating them. That because I'm positive and I'm a woman, then I should be discriminated. Because I'm disabled, then I should be discriminated. So all those kind of things, we should not put any grounds for discrimination issues. Then we must also get informed consent from these people, that if at all you're to advise them to be enrolled on any art therapy or any program or any intervention or any treatment, you must get their permission first before you recommend them to give them the services. Then, furthermore, is the issue of confidentiality. In confidentiality, we must keep the privacy or secrets or information of our clients. We shouldn't disclose the information they have told us. Even if this person is your friend and the other person more maybe is your sister, then you shouldn't disclose the information to other individuals. Then participation is another ethical example where we are looking at this principle. This principle lets us to know that they should also get involved. They should get involved. They have got a right to participate in making decisions that are affecting their lives or that are affecting their health. Whatever they prefer, we should put it into consideration when we are planning, when we are implementing, when we are evaluating this HIV care and service. Then more to that, we need also to be accountable. It's also another principle. Accountability is when we should be transparent to them. We should be accountable and responsive to their needs and their expectations. And therefore, that's such that they can also adhere to the highest standard of quality, safety, and effectiveness. More to that, we look at also the cultural competence in HIV. What culture has to say here, or what does culture has to do? Are you with me, Mr. Waswa? Mr. Waswa, are you with
Yes,
me?
madam.
Yes. So in cultural competence, we are saying that
Yes,
we need
madam.
to
I'm
respect. That is good. We need to respect their values, beliefs, practices, and as well as people you serve. Don't disrespect them because for you you're coming from a well-recognized culture, because for you you believe your culture is superior compared to your patient's culture. Respect their views, opinions, etc. Are we together? Then number next, recognize and address these issues of stigma, discrimination, and all the barriers. Furthermore, communicate effectively and respect people who are having different cultures or backgrounds. Seek to learn from those people that you serve and acknowledge their strength. Provide also a culture appropriate and also tailor the, the information, education, prevention services that meets the needs and the preference of those people. Also collaborate with other professionals as well as the community organizations, who are more experienced and who are more expert in working with people who are positive. Engage them or engage in ongoing self-reflection and also professional development. Also, you need also to get in. You need also to get other stakeholders to get involved in this HIV care. Okay, such that you get the social workers, clinicians, counselors, pharmacists, laboratory technician, public health specialists. All those stakeholders are very important to help or to be involved with people who are HIV positive. Then also look at the established regular communication channels and feedback mechanism among other team members and as well as stakeholders. Develop a vision goal for HIV care services and align it with the national and local policies or guidelines or the standard. Furthermore, connect or conduct a situation analysis where you can be in position to identify the strengths, weaknesses, opportunities, and the threats of the current HIV care and the service delivery system. You have identified the gaps and the challenges, as well as also, it is also very important for you to know the service provision and how are you going to access the quality, efficiency, equity, integration, the sustainability, and human rights. Design, implement, and all these programs must be evidence-based to address and identify the gaps, the challenges, as well as improving service delivery model. Lastly, monitor, evaluate progress and as well as outcome of this intervention using appropriate indicators. Disseminate whatever kind of information you've got. Use the findings and the lessons learned and also monitor and evaluate to inform the decision policymakers how we are going to advocate and also for future planning. Foster culture of learning, develop improvement amongst other team members and other stakeholders, such a way by providing regular feedback, recognition, monitoring, coaching, training, capacity building, and all in all. So I think that's the last slide I have. So Mr. Waswa, are you still with me? Hello? Hello?
Madam.